I'm Alfred Benson. I'll be 90 years old in September 22nd. Disabled veteran of World War II, and I worked for the Herald. That's where I retired from the Herald.
And you loved to climb mountains.
Oh, hike. There's not a mountain in New Hampshire I haven't climbed.
And I'm Claire, I'm his daughter. When he was 35, he had his first heart attack. Recovered from that and did very, very well for probably about 30 years. But then it kind of all caught up with him. And then he began to having peripheral artery disease in his legs. The past 20 years, he's had triple bypass surgery, carotid artery surgery, bypass surgery in his leg, many angioplasties in his legs, and several more heart attacks along the way. So about 3 years ago, we met Dr. Miller. In an early visit with him, he thought that a pacemaker would help my father feel better. So he introduced us to Dr. Wiley, who put in a pacemaker. And upon visiting Dr. Wiley in the same office, he said, you know, if your legs are really bothering you, we have a Dr. Garcia here. Would you like him to take a look at your legs? That's how we met Dr. Garcia. So Dr. Garcia has been with my father for the past 3 years, working to clear blockages in his legs. Although Dr. Garcia has always very successfully been able to clear the blockages, the challenge that's presented is the medications that my father would need to take to maintain the clear arteries, he's unable to take because of a bleeding problem. So Dr. Garcia has had to do continuous angioplasties. After a year or two of angioplasties and realizing that they weren't giving the durability that my father needed. But then the next thing that he brought up was medicated balloons that were being used in Europe but would soon be okayed by our government, and that would be the next thing that Dr. Garcia could try. When they became available in this country, he started using the medicated balloons in my father's legs. So I guess the things that I would want to say about Dr. Garcia is, as a medical person, as a physician, he is talented, he's gifted, he is resourceful, he is skillful. That's all wonderful. But the other part about Dr. Garcia that means so much to people like us is his kindness, his caring, his tirelessness in coming up with new solutions and trying a new procedure, his perseverance, the hope that he always gives to my father and that he gives to his family. He's a person that I think through his vocation to be a doctor, through his professionalism, through his work in healing people, but he builds a relationship with them too. And that's where the intangibles of him, beyond his medical expertise as a physician, that means so much every time we call him and we say, my father's legs hurt again. And he's so accessible. He sees us within a day or two of making a call. We come in, my father has an ultrasound, and it's, okay, Alfred, you're gonna stay overnight, or we're gonna do your legs again tomorrow morning. Or those are the things that mean so much, because you're dealing with a loved one, you're dealing with someone in pain, you're dealing with somebody in need, and he fulfills all of that. He's a wonderful, wonderful doctor, but he's an exceptional human being and a wonderful man.
Yeah, he tells me stuff medically, and he always tells me so that I understand what he's saying. You know what I mean? I don't understand the medical terms, so then he comes back and tells me just what it's all about.
He's persevering. He doesn't give up on you. I don't believe my father would have his 2 legs and would be in his home today if it wasn't for Dr. Garcia. It matters to me as a person who lives in the suburbs. I live in Mansfield, I pick up my father in Stoughton, and I drive to Boston. Honestly, the facility itself, It's so easy to come in here. That valet service is wonderful. They take my car, they park my car. You're not dealing with the stress of a parking lot or finding a space. They return your car to you. If you're here when they're gone at the end of the night, they bring your car up and put it right outside the door for you. It's at a very nominal fee. So, like, it's easy to come in here. You don't have that overwhelming feeling that you can when you're more in the city, I think. It's a big hospital in terms of square footage, but somehow or other, it truly has been able to maintain that feeling of a community hospital that you usually only get out in the suburbs. I don't feel intimidated when I walk in here. I don't feel lost when I walk in here. It's a very accommodating facility. It means a lot to somebody who's not a city person. My father was in the hospital the past 2 weeks. He had angioplasty in one of his legs last Friday and angioplasty in the other leg the Friday before. Now, you saw how well he walked here today. Once he has a couple of days of recovery at home, you're really pretty able to walk around. My father he lives alone.
I do, I walk all around the house. I've been in a lot of hospitals, but I think this is the best for food and for caring nurses and stuff like that. I would recommend it to anybody, myself. I would.